Are you pregnant and considering getting a home Doppler for yourself? Here is why most OBGYNs don't recommend it, and my situations where I think it's fine to check in on your baby. I think the important distinction to make in this conversation is how far along are you in your pregnancy? Because it's a lot different at 15 weeks than 35 weeks. Now, when you're in the second trimester, this is when I think it's appropriate to use a home Doppler if you just want to check on your baby. You're very likely not feeling fetal movement yet, and you just want to feel reassured. So between about 14 to 24 weeks, I think if you want to check on your baby once in a while, I think that's fine. You definitely don't have to, but I think it's an option. I don't really recommend under 14 weeks because it's very difficult to find a fetal heart rate when they're so little. I myself in the office don't check until at least 13, 14 weeks for my patients because half the time you're not going to get it under that gestational age. If you do want to do a Doppler on yourself and you're not sure what you're listening for, I'm going to show you an example of what a fetal heart rate sounds like and what my heart rate sounds like on a Doppler. The first sound you heard was the baby's heartbeat. You can actually hear the heart bells clapping. And we expect that to be between about 110, 160, a little higher if you're still early on, but you want the hard clapping noise that's faster. That whooshing sound under 100, that was me. If you think trying to tell the difference is gonna freak you out, definitely don't do this. This is absolutely not mandatory. This is just an option for those of you in the second trimester who wanna check in on your baby and wanna hear the difference. Now, once you hit viability, you really should be feeling some fetal movement. So if you're not and you're concerned, I don't want you to just check to make sure there is a heartbeat, because at that point, it's not just important, is there a heartbeat, but what is the heartbeat like? So once you get over 24 weeks and you have a concern, I want you to come to the hospital. Come to triage where we can do a non-stress test, maybe do an ultrasound and make sure that baby is looking good. And the same applies to us like in the office. I know we check the baby's heart rate like for routine visits, but if you were to say to me, like, I don't really feel my baby move and I'm not really assured, I'm not just gonna do a Doppler, I'm gonna put you on the non-stress machine to see how is this baby tolerating the inside. Because again, it's not just is there a heartbeat, but how good is it? So to summarize, in the second trimester, if you wanna check on your baby, I think that's fine. Once you get past viability, 24 weeks or above, and you're concerned, I need you to go see your OBGYN or your midwife to check in on your baby, because it's not just is there a heart rate, but what is it like?